for the majority of cases, food is like the cornerstone of managing CKD. It's kind of akin to like the worst hangover you've ever had. We normally refer to it now as chronic kidney disease or CKD. When you do pick it up earlier and you put the necessary interventory things in place, you can actually end up giving them still a reasonably long, full life. And they often come and say, I think there's something wrong with my cat's teeth. You may not be able to put your finger on it, but let us do the work.
And a lot of the time when you get baseline really good blood work, it's not a waste of money.
No, we're like, sweet.
We love those. Welcome back to the Pause and Effect podcast. I'm your host, Dr. Cara, and I have a returning guest, Dr. Nicky Hogan. Thank you so much for coming back.
Thank you for having me.
Last time we had the opportunity to talk about puppies.
Yes.
And that was a really interesting conversation because obviously we want to set our pets up for a great life.
Yeah.
I've asked you to come back to talk about maybe what can be a little bit of a morbid subject.
Yes.
But a very relevant one because as our pets age, it is possible that they may suffer with some part or the condition in its entirety, and that is renal failure. So that is our subject of today. And I suppose my first opening question for you is,
yes,
can you tell our listeners what is renal failure? It sounds pretty
dire.
Yeah. Stage.
It does.
That word failure.
Yeah, I try where possible these days to kind of sort of move away from that term because people hear that and they sort of go into like panic mode. We normally refer to it now as chronic kidney disease or CKD because there are varying stages and levels of it. And, you know, we're getting a lot better at picking it up much earlier. And so when you do pick it up earlier and you put the necessary interventory things in place, you can actually end up giving them still a reasonably long, full life. So, yeah, I try and stay away from failure because it does make people panic. And I think our understanding of how the disease works and, you know, what it involves and all that has improved, and we are able to be more proactive about slowing the progression. And I think that's an important point to make here is that, unfortunately, once an animal has chronic kidney disease, we can't fix them. We can't. It's never reversible. Well, there's a very small percentage of cases when, like, an acute renal disease, but on the majority, you can't fix them.
So there's no regenerative capacity.
No. Once those little nephrons, which are the individual bits and pieces inside the kidney, once they're gone, they're gone. We can't get them back. And unfortunately, we only traditionally have picked it up quite late in the disease. The kidneys are remarkable at the nephrons that are still functioning. They almost sort of hypertrophy or get bigger and take on more work for the ones that aren't working. So by the time you see changes, whether it's in the animal's behavior or, on the blood results, you know, you've got anywhere between 65 and 75% of the functional mass of the kidneys gone.
Wow.
So, you know, you're really kind of on the back foot.
So they compensate a huge amount before you
so.
actually see signs.
Yeah, absolutely. And I would say both dogs and cats to a degree, but certainly cats are absolute maestros at hiding clinical symptoms and appearing to be normal on the outside. And they sort of cope, and then all of a sudden the wheels come off. And often owners will be like, but he was absolutely fine last week and now he's vomiting everywhere and he won't eat and he's lost so much weight. And they perceive it as this massive, very quick decline. But I always explain to people that it's actually an exhaustion of those compensatory mechanisms. So they go into that compensatory phase where they look outwardly normal, they're still eating, they're doing all of that thing, all of their normal things. But eventually they run out of those compensatory mechanisms and then they have this, what we call an acute decompensation, and they just tank. And that's what owners are seeing and sort of not realizing that it is a chronic disease that's been happening in the background for a very long time.
Okay, and so people are often very shocked with the diagnosis.
Yes, absolutely. And they're like, but where did this come from? Mm-hmm. And so there are symptoms to look out for.
So let's discuss some of those.
So one of them, I'm going to focus primarily on cats because we see majority of our CKD cases are cats. We do get dogs, and don't get me wrong, they're no less important in this situation, but we treat a lot more CKD cats than we do dogs. So often there'll be changes in appetite. So, perhaps the cat has always been interested in the pellets, and then the owner's like, oh, he doesn't want to eat his pellets anymore, and now he's just wanting the soft food. And they often come and say, I think there's something wrong with my cat's teeth because he's only wanting the soft food and not the pellets. And I'll have a look, and often there's absolutely nothing wrong with the teeth. And it becomes down to sort of palatability and basically how they feel.
The appetite is just...
Yeah, their appetite is just affected. So they'll tend to pick out the really nice things. They might go for some roast chicken or whatever rather than just the run-of-the-mill pellets. And it's got nothing to do with functional mouth lesions, but because they just feel rubbish. And so the only thing that they will eat is something that's slightly yummier. The one exception to that is when it's really, really end stage, they can get mouth lesions where you can get like ulcers on the tongue and so on, and that's really horrible
and painful. Hey?
Yeah, I have to say though, I haven't seen that for a very long time because I feel like owners are now better informed and they're a lot more observant and are picking up on clinical signs before we get to the mouth ulcer kind of stage. So but that's the only time that you would get sort of oral issues that would make a cat not want to eat with kidney disease. So and other things would be weight loss. And it's obviously much more common in older animals, older cats and dogs. There are certain breeds, like your Persians, are predisposed to polycystic kidney disease. And a lot of Persians will have polycystic kidneys, but they'll still be functional. So it's not necessarily the end of the world. But, whenever you see a Persian come in, and even if it's 3 or 4, and it's not eating well and it's lost some weight, like the first thing you think is kidneys, just to, you've got to rule it out. But so, increasing age is always one. Weight loss, fussiness with food. Sometimes there's vomiting as well because they just, they feel so rubbish. And I suppose probably important to just note that the kidneys are essentially filtering waste products out of the body. So when they're not working properly, then obviously all those waste products build up in the body, and that just makes them feel rank. The nausea is next level. And so, but unfortunately not all cats who are nauseous will vomit. Sometimes they just refuse to eat.
Or they salivate or...
Yeah, absolutely. A lot of cats do salivate. So, when an older cat comes in and the owner says, oh, there's been some weight loss and not eating nicely and there's been the odd vomit.
Maybe not grooming, their coat sometimes stick out. Have you
Yes, they
seen
get,
those?
that sort of unkempt sort of coat. There's always like a list of what we call differential diagnoses or like possible things that could be causing it. But yeah, CKD is always up near the top because it is so common.
Welcome back to Just for Pets. You're with Dr. Cara.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help. And maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today and we'll deliver pronto.
Wow, I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.
Before we continue, let's address a critical aspect of pet care, gastric health. Introducing UltraPet's special diet gastric liquid care, formulated to aid pets during recovery from gastrointestinal issues. This versatile product boasts a balanced formulation with 31% protein, 9% fat, and 3% fiber, replenishing key nutrients essential for pets recovering from gastric issues. Featuring a delicious chicken flavor, it is highly palatable, encouraging pets to eat during recovery. I've had great success using this both with tube feeding and syringe feeding patients. What sets this liquid care apart is its comprehensive approach to pet health, with added prebiotics for digestive health and omega-3 and 6 for immune support. It is a holistic solution for upset stomachs. Ultra Pet's gastric liquid care comes in a 750-gram pack, providing an optimal solution for pets in need. Give it a try and witness the difference it makes to your pet's recovery. Your companions will thank you, and you'll appreciate Ultra Pet's dedication to pet health. Now let's return to our conversation. And I mean, by this stage, you were talking before about acute and chronic. By this stage, this is now chronic. So this is where your definition of it being a chronic condition comes. So when it happens in the acute phase, are the symptoms just difficult to miss? Do most people not see the initial insult, or is that this is quite progressive and nobody really sees acute unless there's let's talk about what we may see as acute, particularly in dogs. We had a conversation before about
toxins.
So
toxin is a big one with dogs. And so, for example, antifreeze, if they ingest that, unfortunately, it's extremely sweet and it's a nice tasting substance. And so dogs will often lick it up. And, if you're not around in the garage or whatever, when the dog is there, you may not see that initial ingestion. So, and other things like what we call pyelonephritis or infection of the actual kidney. So this is not the same as a bladder infection or a UTI. This is an infection much higher up into the in the actual kidneys, and that often causes irreversible damage. But if you catch it early enough, you can reverse it with aggressive fluid therapy and monitoring acid-base balance and all that kind of thing. So often it does go unnoticed because people are busy and out living their lives, and you don't necessarily see if there is any kind of toxin ingestion. And if you get to it early enough, so especially with the toxin side of things, if you get to it early enough and you treat them straight away, it is potentially reversible. But that's by far the minority of cases. I mean, I can count on two hands the number of acute renal failures I've seen or acute kidney disease. It's almost always chronic. And then it becomes a management situation. And I think that's quite tricky for people to understand. They're like, well, here's my pet. You know what's wrong with it. Why can't you fix it? But it becomes a case of sort of palliative care because we want to make them feel as good as they can and maintain functions for as long as we can, but we can't fix them. And that looks different to different people. And it also depends on what stage they get brought in at. If we're doing, it's one of the main reasons that we run our pre-anesthetic bloods. Because if an animal is kind of outwardly normal and it's 8 or 9 and it's coming in for a procedure, then we always say to people, look, to be on the safe side, let's just run a panel of bloods. It's just a mini panel. Make sure that liver and kidneys are okay for an anesthetic. And, we do that for a very good reason, and we're trying to sort of pick up cases much earlier than we have in the past. And often something will get flagged and be like, whoa, hang on a second.
And the last thing you want to do then is
anesthetize,
drop their blood pressure, reduce the flow to the kidneys,
and make it 1,000 times worse.
Okay.
And an anesthetic in a cat that's just barely kind of hanging on is certainly going to push it over the edge. Yeah. So we have sort of more sensitive tests now than we used to have, even maybe 5-10 years ago. So we would run a normal panel of bloods, and then we would run something called an SDMA, which is a more specific marker for kidney disease. It measures basically how much blood flows through the kidney, and that can be influenced by a number of things. So it can be if the animal is dehydrated or if they're in shock or whatever. But your standard run-of-the-mill animal that's coming in for a dental procedure or something, I mean, we're assuming they're healthy. And so if we run that panel of bloods and the main markers are all fine, but that STMA is raised, then we go, hang on a second, how urgently does it need these teeth done? You know, is it just there's a bit of a bad breath, can we need to clean it? Or, you know, can we hang on for 6 weeks while we put them onto the right type of food? And probably a good point to make here is that for the majority of cases, food is like the cornerstone of managing CKD. Mostly because our proper renal diets, the formulated ones, have much less phosphorus in them, which is super important in not progressing the disease. And then also having a highly digestible, high quality protein. It's not restricted as such, but it's not an abundance of protein. So it's what the animal needs to be able to function and get all its body functions going. But you don't want them to be living on, 4 chicken breasts a day kind of thing. Like
and you
that
want it to be
level,
balanced.
Yeah.
Of course.
That level of protein is just, not good for chronic kidney cases. And so in that case, the animal that came in for a dental, we would see, okay, well, that's not looking great.
And this is now early on.
Very early on.
Owners haven't even noticed.
There's
the
no
signs.
weight loss. There's no increased drinking. There's no nausea. It's eating super well. So it's literally just like, potentially a stage 1. And then we change them over onto the renal food. And the important thing is to make sure that it's done really slowly. Because it's not just a food, it's actually a medication at the end of the day. So we want to make sure, and cats can be notoriously picky about their food.
And I think one interesting thing, sorry to interject, is that they have found in human studies that the taste sensation and the taste buds change in patients with renal failure. So they get a different sensation, or some people remark that they get a metallic taste, for example. So not only does food become less palatable if they're not feeling well and they're building up those toxins, but they also
react differently.
Taste the same.
Yeah.
So you don't necessarily want to eat as much.
Exactly.
So it's quite a tricky thing. We have found it quite difficult sometimes converting our patients from
absolutely
regular diets to
and that's why it's so important to do it over a long period of time. I always say to people, look, you are aiming for over the next month. By 4 weeks, we should be moved over onto the renal food. And literally, if that means on day 1 to 5, you put 3 kidney pellets in with their normal food and then just really gradually kind of take the old food away, that's what we want because we need them to eat this food. It's
need
our
them
biggest,
to eat.
Yes.
So I think, the last thing you want is they already have so much muscle mass loss and maybe not at that stage if you're doing it. But you don't, the last thing you want is them to deteriorate as a result of depriving them of food.
Yeah,
so
exactly.
It's such a fine line of like, we want you to eat the renal diet, but we want you to eat.
Yes,
and
it is
there
a
are
tricky
some
one.
cases where, I know even within our practice, because we discuss our cases, that we've gone, we can't manage to get this cat on this renal diet. We're going to have to add in some phosphate binders in order to try just help.
It needs nutrition,
Yes.
and if it's not the right
just
one,
let it eat.
then we just have to kind of make
manage some
plan
of
B. So I think I mentioned earlier that sort of CKD looks different in different animals and in different families, and what owners are sort of prepared to take on. So the food is always a mainstay. Sometimes they need added medication because they often have sort of moderate to severe high blood pressure or hypertension. And so sometimes we need to add in a medication that will deal with that.
Okay.
And then probably as it gets sort of towards the later stages of the disease, then we get to the point. So when they're in the later stages, that's when we normally see them, and they're, they've lost weight and they're depressed and they're dehydrated and whatever. And then we put them on. We run the initial bloods and we see all the parameters are scary, and then we put them on fluids for 48 hours, a high rate of fluid, and then we retest them 2 days later. And if the cat is eating, even if the parameters aren't that much improved, then that's a win. I remember one of the specialists telling me once that it's very important to treat the patient and not the lab results or not the x-rays. So, I've had cats with creatinines that are like in the 1200s, and they're smashing their food and they're not vomiting and they're happy and whatever. And then you might have a cat who's got a creatinine of a third of that and they feel revolting. So we use the blood results as a way of monitoring, but it's important to also look at what the cat is like and how well they're coping.
Yeah.
And I'll often say to people, look, long term, it would be helpful on top of the food if we could give it fluids, what we call subcut fluids. And I'll say to the, is that something that you'd be interested in doing or, willing to try? And a lot of people sort of get a little bit panicky in the beginning. And they're like, what, a drip for my cat? I can't do that. But cats tolerate it remarkably well. And it's not like you're looking for a vein or anything. So I'll send them home with a drip bag and an admin set and a needle. And they literally just stick it under the skin at the back of the neck and put in 100 or 150 mils every second or third day. And it's quite remarkable how much that helps those cats. Because cats generally aren't big drinkers, so they don't drink as much as they should in order to maintain their hydration. Yeah. So at least if you're doing that, they're feeling better. I always say to people, they look a bit like the Hunchback of Notre Dame.
Those cats, Jim.
and then when I don't warn them, and then suddenly they phone back a couple of hours later, they're like, my cat's leg is all swollen. And obviously that's just the fluid gravitating down. So, that's an option for people. And some people will be like, sweet, I'm all in, let's do this. Other people will be like, no, I can't do that.
So I want to take us back a few steps, because you made mention, obviously, of you see an increased thirst and possibly urination. So they're drinking and they're urinating a lot. And obviously the distinction between dogs and cats is sometimes the cats, outdoor cats, you don't even see this because they've got a fountain they drink from, or they drink from another water source, and they're urinating outside. If you've got a litter tray, people obviously say, I'm emptying the litter tray a lot more frequently. With dogs, they tend to, especially if they sleep inside, they tend to ask to go out more, and they're emptying their water bowl. And now, there are a few questions here. I'd like us to take the opportunity to talk about why, if they're drinking so much, why they're urinating and why they're not managing to flush these toxins out, why we recommend fluids. So let's start there, and then
okay. So one of the main functions of the kidneys, as we said, was to detoxify the blood and remove waste products. Another really important function is maintaining hydration state. So if you go the whole day without drinking any water, you might urinate once at the end of the day, and it's a small volume and it's very dark. The same thing goes with dogs, for dogs and cats. So, in a cat that is healthy, if they don't drink a lot, their kidneys realize where their hydration state is, and they concentrate that urine very well so that they don't lose excess water. So when you have CKD, that doesn't happen. So the kidneys have lost the ability to concentrate the urine. So they urinate a lot, And because they're urinating so much, they have to drink so much. They're drinking to replace
So
the
it's compensatory.
fluid. Yes,
That's
that they're
compensating.
losing.
Okay.
Yes, exactly. And so much so that I mentioned about the parameters. The STMA can be raised if the animal's dehydrated. So if you've got an animal coming in and it's been missing for 2 days and it's dehydrated, you can see its eyes are sunken and its skin tinting and whatever, and you get a little bit of that urine, and that urine is really, really concentrated, you kind of breathe a sigh of relief. You're like, okay, cool. The body is trying to respond to the fact that it hasn't had access to water or whatever. But if you take that urine and it's very dilute, you're like, oh, okay, so, we really need to focus on these kidneys. So, and obviously there are other functions of the kidneys, which I'm sure we'll get to later. But, yeah, I think especially with cats, because they are often outside, they're drinking on their own, they're urinating under a bush or whatever. So you don't notice it as much as you would with an indoor dog.
And so why then are you putting them on fluids? Why is one of the main treatment regimes then sort of in hospital the fluid therapy?
Partly to flush out the waste products that are accumulating, so that makes them feel better, but then also to replace the water that their body has lost. It's kind of akin to like the worst hangover you've ever had, and that constant feeling of, a headache and that thirst that you cannot satisfy.
Quenched.
Yeah, and that's what that's their perpetual state, which just really sucks.
It's miserable.
Yeah.
So the time frame, obviously, we try and advise owners that it's a case of monitoring to see how quickly you can get them back to normal. But it's an individual response, obviously, or it depends on the...
And sometimes you'll do the 48-hour mark and repeat those values, and they've halved, or they're even lower than that, and the cat is eating and there's no vomiting and it's wanting fuss and love and it's grooming itself again. You're like, okay, cool, we're on the right track. If that's not the case and they're still looking miserable and they're still not eating, look, we do give them things like appetite stimulants, or you can put a feeding tube in and so on. But I think you have to also kind of be in regular communication with the owner at that point, because yes, you can give them another 48 hours, and sometimes some cats just need, an extended stay on IV fluids, and that's great, and and then we send them home. But generally at that point, I will say to people, okay, we haven't had much improvement in how the cat is feeling in itself, and that's always a concern. And I always say that once we take them off the drip, they do deteriorate. Like it might take 2 weeks, or it might take a month, or whatever. So the only way we would really we have to get them to their fighting fit state when they leave hospital. And if we can't get there, then they're never going to cope at home. And so that's always a tricky conversation to have, because, you want to do as much as you can for the animal, but you also I personally don't ever want to be in a situation where I hospitalize a cat every 2 or 3 weeks for 3 or 4 days to be on fluids, and then it maybe has like a good week, and then it just feels rubbish again. I think that becomes a question of quality of life, and are we really doing something useful and helpful to the animal? Part of my sort of rationale of the way that I approach cases, whether it's CKD or anything else, I'll often say to people, if I tell you that the next week is going to be really, really difficult, and we are, Fluffy or whoever is going to feel really rank for that time, but at the end of that week, we've got a good prognosis, a good shot at good quality of life where they're happy and healthy and well and everything, then we just put our heads down and we power through. But if we get to the end of that week and they're just still there, then what are we trying to achieve
as well?
Yeah. So it can become a tricky conversation, but each cat in each animal responds so differently. So I won't have that conversation right up front. I'll say, let's stabilize, let's try and get the cat eating better and grooming and whatever. We'll do it for 48 hours, retest, and then we reevaluate.
So, I mean, you're talking about a lot of the stuff which is end stage, which is,
Yes.
we know it. But can you take us through, because it's been a fairly new sort of situation, even since I qualified, is the staging process of renal failure, which I don't know whether it's helping. It's certainly helping us professionally.
Very much so.
I don't know whether it's helping provide clarity for owners, because it feels very confusing, perhaps. Can you help us understand better the staging process and perhaps why it's in place, so we can best know that if they are stage 1 or stage 5, what that means?
So it goes a lot on what the blood parameters are. And so the one thing we monitor very closely is something called creatinine. And so there will be staging according to that, and also how much protein they're losing in the urine, because that's what ends up happening is they go into a catabolic process and they use up their own muscle stores, which is why they lose the weight in the first place. And yes, it can be quite confusing for owners to say, oh, my cat's got kidney disease, but it's, stage 1 or stage 2 or whatever. But it does help to know what we need to do. Is this a case that just needs the food change? Does it need food change plus a blood pressure drug? Does it need a phosphate binder to make it feel, less miserable? And that's why we stage it, so that we can determine what treatment is necessary. So it's probably not terribly helpful for owners, but it helps us. And if I were to have a patient who moved down to Cape Town, I could send all the blood results and say, stage 2 renal disease, this is what we've got it on, these are the last blood results from a month ago, and it immediately the vet down in Cape Town knows exactly where we are and what the plan is and so on. So it's useful to have continuity for
reference in time,
and
also
exactly.
progression. So gone from stage 2 to the stage in a short period of time, despite all these.
Exactly.
Okay. All right. So we obviously spoke through some of the clinical signs. Can we just go through them, because I want to get
like in a nutshell kind of thing.
So things that owners will see, obviously.
Okay, so increased drinking and increased urinating. Pickiness about food, weight loss. Towards the end they might have funny tastes, funny smells in their mouth. There might be the ulcers, and then they probably won't notice it, but like sunken eyes and skin tinting and so on,
That's
indicating
dehydration.
Indicating dehydration. So it kind of varies dramatically, and as you said, it depends on whether they're indoors or outdoors or what they're doing. But I think the take-home message really is, if you notice a change in your cat's eating habits, or if you giving them a love and you think, oh, that's being female but more bony than usual, really the take-home message is, take your animal in to your local vet and let them examine it, express your concerns about things. They can weigh it and say, oh, your cat's lost half a kilo since it was here 6 months ago, which is always a massive alarm bell. And then we can do the appropriate testing and put the animal on the correct treatment based on where it is in the staging process.
And that's to support them ultimately in terms of...
The other thing that I should probably just make a point of is, like, you can't ever stop it, prevent it from happening, but you can look at putting older animals on age-appropriate diets, and potentially even diets that are, what we call prescription diets. So, I've sort of come to the conclusion that if I have an animal in for a vaccination, and so say it's a 12-year-old cat, and it's looking great, and it's got good muscle tone, and it's eating well, and it's currently on an adult food, I'll say to them, look, we really should be on a senior food at least. And then I'll chat to them a little bit more, and they say, he does battle a little bit to jump up on the counter to eat his food compared to, he sort of has to think about it and really kind of psych himself up to jump. There are foods that you can put them on that support kidney health and joint health and all of those things. And often, putting them on it before it becomes an issue, you might delay the onset by a year or 18 months. So
it's significant.
Yeah. It's worth doing.
So I don't want to lose the opportunity because I know we're running out of time. You made mention, obviously, of some of the other things that you see as impacting these renal patients, often because they're older. And I want to talk about, it's spurred my thought process in terms of, the arthritic patient jumping on the counter. The use of meds and how other meds can impact the kidneys. So the meds that people need to be aware of that can have significant impact on the kidneys, but also the other disease processes that can impact kidney health, possibly because of dehydration, I don't know. But if we can just have a discussion about that, because I think often renal failure or kidney disease doesn't always appear in isolation.
Yeah, absolutely. Like there's often multiple things kind of going on at the same time. And, you may have an animal who is, let's switch to dogs for a little bit. You may have a 10-year-old dog who's, battled with arthritis their whole life and has been on, say, a joint supplement or a joint food and has been doing pretty well on that. But now that it's winter and they're struggling a lot more, and the dog is kind of taking longer to get up, and you're like, okay, well, I think we're moved beyond just joint supplementation. We now would like to put them on an anti-inflammatory or something. And that's where ideally you would need to run some bloods, because an animal who's in early stage kidney disease, putting them onto an anti-inflammatory can make things dramatically worse. And you add into that, the owners are away for the day and the dog's outside and the water bowl is empty and it's hot and they don't drink as much as they should, and now they get an anti-inflammatory. That can really make a big dent into the kidneys in terms of how well they function. So you do have to manage them. Yeah, you can't manage one organ system in isolation. You often have to look at multiple organ systems and take that into account. And slightly different kind of tack, but a cat's hit by a car and it's shocky and it's pale and whatever. You want to make sure you get that animal on a drip and get its blood pressure up and rehydrate it properly before you give it an anti-inflammatory, because if they're older and they're kind of hanging on by a thread, the shock itself can push them over the edge, but then you add in an anti-inflammatory and they really do a lot of damage
to their kidneys specifically.
Yeah, absolutely.
So is kidney disease painful?
No, I don't believe it is. I think it's more a case of how it makes you feel. It really does make them very nauseous. And And so we sometimes need to add in anti-nausea medications, and because they're not feeling well, they don't want to groom, and then they're kind of they take themselves off and they want to go and not be around people because they're just not feeling well. So I don't think it's painful as such, but it does have a significant impact on their quality of life. So if we can get to them earlier, before all of that happens, and preemptively put them on the right food, and if necessary put them on a blood pressure medication, we can have them around for so much longer, and that's ideally what we want. And there's a lot that's involved in the workup process. I mean, sometimes we need to do things like ultrasounds, abdominal ultrasounds, to visualize what the kidneys look like, because a cat that's in chronic kidney disease from being old and whatever is a kind of a different ball game to a cat that's got lymphoma of its kidneys or something. So you need to be able to differentiate
the cause potentially
to a certain extent. Yeah, because that does definitely influence the outcome of the whole process and how well they will respond to our treatment and our interventions.
So, take-home message for owners if they suspect or see any of these signs is clearly, like you say, to get early advice and an early workup that may include the vet drawing some blood to look at urea, creatinine, SDMA, and various other parameters like, chronicity in terms of the phosphate, and potentially collecting blood pressure, urine sample, a dipstick to see whether there's protein in the urine. So these are normal things, which obviously a lot of people are reluctant to, because they firstly, traveling with a cat is sometimes very stressful, and trying to get a cat into the practice can prohibit a lot of people. Secondly, obviously, financially, it is quite a big outlay for a workup because it requires multiple steps. But on the plus side, sorry, just to interrupt there for a second. On the plus side, you get an enormous amount of information via very non-invasive tests. Okay, so even that's what I was going to ask you. Even the action of taking a urine sample, a lot of people, are just perhaps our final thing is just to prep people of the way in which we can sample the urine, because with cats you can't just pop a bowl underneath. Like, we send some of the dog owners outside and we say, please can you get a urine sample for us? And they there with their metal tray. With cats, obviously, often we need to sample them ourselves, whether it's either under guidance or not. So sometimes we have to do what we call a cystocentesis, which is basically sticking a needle and syringe into the bladder and drawing some urine out. Obviously, we shave the area and prep it, sterilely and so on. And it's a very helpful way of kind of seeing what we're dealing with. And certainly if we have to do things like urine cultures for a suspected pyelonephritis or whatever, this is the preferred method because you don't have any bacteria, like commensal bacteria from the urinary tract. So everyone's like, oh, you took it directly from the blood. And I have done it so many times, and the cats actually just, they're fun. Mm-hmm. No,
they
are
cope with it remarkably
But I
well.
wanted us to talk about it because I know that could often be a shocker. When we get into, we've been qualified quite a few years, when you get into practice of going, I'm just going to, the cat's quite calm, I'm just going to get a urine sample, people are often horrified. You're like, it doesn't hurt. It's absolutely fine. It's less traumatic than potentially trying to express that bladder, which can be really uncomfortable and unpleasant for all. Just the kind of expectations people can have in terms of management thereof. And obviously, like you're saying, a lot of your treatment strategies are then guided by your findings.
Yes.
And you get a huge amount of information from quite a little bit of investigative work.
And it's going to impact the cat's life in the long run. And I think, we are so much more proactive than we used to be. And we're seeing, I can't even remember the last time I saw a renal failure case with the uremic ulcers in the mouth. I can't, like 12, 15 years ago maybe, because I feel like we're just much more observant. And owners are keen to fix what they can fix or manage what they can manage.
And more engaged, like you say.
Yes.
having that connection
And more
with
invested.
more invested in managing things early on, which is
Yeah.
great. Any take-home messages?
Trust your gut. So if you feel like something is up, and even if you can't put your finger on it, bring the animal in, let us have a look. We will often be sizing things up and feeling things, and we're having a conversation about how you went to the hairdresser yesterday and whatever, but we're actually, the whole time, the brain is ticking over.
Assessing.
So you may not be able to put your finger on it, but let us do the work.
And a lot of the time when you get baseline really good blood work, it's not a waste of money.
No, we're like, sweet.
We love those.
Yeah.
When obviously, people, when they're paying for something, they want a result. And we say this is a result, knowing that your pet is healthy and well. We never feel that there's a wasted journey.
That's a win.
So
That's
that
always
is
a win for us.
That's great. Thank you so much for your time today. You've
My
got a really
pleasure.
great way of explaining things and very practical. So
Thank you for having me.
thank you, Dr. Nicky.
Thank you.
Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform.
We have an exciting announcement to make. We are looking for guest speakers who are passionate about the pet industry and sponsors to support future episodes. Are you an expert in pet training, nutrition, or behavior? Maybe you're a veterinarian with insights to share, a pet store owner with unique experiences, or a pet product inventor. We want to hear from you. The Pause and Effect podcast is a platform for industry professionals like you to showcase your knowledge, experiences, and stories. As a guest speaker on our podcast, you'll have the opportunity to share valuable information, engage with our audience, and have your voice heard in the pet community. Whether you want to discuss training techniques, emerging pet care trends, or the importance of mental stimulation for pets, we want to feature you and your expertise. So, if you're passionate about pets and have something to say, we invite you to join us on an upcoming episode of the Pause and Effect podcast. But wait, that's not all. The Pause and Effect podcast is also seeking sponsors to support our mission of educating and entertaining pet lovers worldwide. By becoming a sponsor, you'll gain exposure to our engaged audience and have your brand associated with the love and care that we have for our four-legged friends. If you own a pet-related business, offer pet products or services, or simply want to align your brand with our pet-loving community, we'd love to partner with you. As a sponsor, your brand will be featured prominently in our episodes and our social media channels. It is a great opportunity to showcase your offerings to a dedicated audience of pet enthusiasts. So whether you're an expert in the pet industry looking to share your knowledge, or a business seeking to reach a pet-loving audience, we want to hear from you. To apply as a guest or to inquire about becoming a sponsor of the Pause and Effect podcast, please contact me at drkara@pauseandeffect.co.za. Get in touch and let's discuss the various opportunities. Thank you for joining us today. We can't wait to welcome our future guest speakers and sponsors to the Pause and Effect podcast. Remember, every episode is an opportunity to celebrate our four-legged friends.